So I am Dr. Arvind Kumar from Mapmygenome. I am head of lab operations and I am taking care of reproductive and oncology genomic division at Mapmygenome. So the microarray and microarray and NGS advancements largely developed clinicians more than ever before. The classic examples where earlier, even before 5 to 6 years, there is around 20% prenatal cases, 80% postnatal cases. Right now, the current scenario is postnatal cases are 20%, prenatal cases are 80%. All thanks to the early detection of the disease by using microarray and NGS technology. With the examples like NIPT, we can able to detect Down syndrome, Edwards and Patau syndromes even before the child is born. And when it comes to microarray techniques, if the scanning of nuclear translucency is at higher than 3.5, they're immediately going for chromosomal microarray, and we can able to detect the abnormalities with confirmation by chromosomal microarray. Technological advancement in genomics not only influenced pediatricians, that also influenced gynecologists to take decisions even before the pregnancy is being manifested. For example, especially in terms of PGS and PGT, now we are selecting the embryo so that the better embryo can be implanted into the mother. That means we are selecting a reproduction of a healthy baby altogether even before manifesting into a baby. So this is a very long way. This has happened with NGS technology, where we can select the embryonic cell which has actual proper chromosomal number, and also we can avoid lot of genetic disorders like autosomal recessive disorders, which has a 25% chance of getting into population. For example, Huntington's chorea, alpha-nuria, these are all the autosomal recessive disorders which can be avoided when you do PGT, pre-implantation genetic testing. So there are two things again: pre-implant genetic screening and genetic testing. Testing will be done by a specific method where you can avoid disease by selecting the cells which are not having any disease. So this is a classic example of where the development took us actually. Conventional biochemical techniques are always have their own challenges. Like marker testings, you have very limited information, as well as there is always a dilemma about the sensitivity and specificity of this test, which is overcome by using genomic technologies. Your sensitivity is increased to 99% when it comes to genomic technologies. Like NIPT, detecting any kind of aberrations which are pertaining to copy number variations has increased very widely. PGS, PGD are now into the picture, where you are actually selecting the best embryo possible so that you can get the best outcome and the healthy babies.